We are in Module 3 of the CHS Training for Quality and Accountability focal points, looking at what you need to know on each commitment of the CHS in order to support your organization's implementation of and verification against these commitments. In this presentation, we are going to look at Commitment 2. Commitment 2 of the core humanitarian standard is that communities and people affected by crises have access to the humanitarian assistance they need at the right time. The quality criterion is that humanitarian response is effective and timely. This commitment is important because it highlights several needs. An organization needs to have effective systems that support timely, evidence-based decision-making. It needs to have systems that also support comprehensive responses that overcome challenges such as access, security, funding, logistics, and capacity. Lastly, systems need to support a response that adheres to minimum technical standards. There are 5 key actions for Commitment 2. 2.1. Design programs that address constraints so that the proposed action is realistic and safe for communities. There is a requirement regarding prevention of sexual exploitation and abuse and harassment. To fulfill Key Action 2.1, programs need to take into account organizational and contextual constraints so that the proposed action is safe in relation to PACAH for communities. This is usually done in PACAH being part of your risk assessment, and following the assessment, programs design need to be adapted to safeguard people from sexual exploitation and abuse. Key Action 2.2 deliver humanitarian response in a timely manner, making decisions and acting without unnecessarily delay. 2.3 refer any unmet needs to those organizations with the relevant technical expertise and mandate, or advocate for those needs to be addressed. (2.4) Use relevant technical standards and good practice employed across the humanitarian sector to plan and assess programs. 2.5 Monitor the activities, outputs, and outcomes of humanitarian responses in order to adapt programs and address poor performance. Think about the 2 levels on which you might be engaged with these indicators. One is to support the implementation of the CHS in your organization, and the other is to assess your progress. What types of things might your field teams be doing if they were fulfilling these indicators? This commitment is about providing the right activities at the right time, with contingency and preparedness plans in place. In order to meet the requirements of Commitment 2, staff working at the project level will ensure all community members feel they can safely access activities and services. Staff will regularly assess and identify constraints and risk. Constraints include access, logistics, funding, seasons, weather, and risk includes security and protection issues. There need to be systems for monitoring at different levels of the organization, such as departments, offices, countries, programs. Monitoring reports need to incorporate qualitative and quantitative indicators covering activity, outputs, and outcome, as well as timeliness of results. Timeliness of results will help identifying delays. Monitoring must involve input from communities and key stakeholders. It is important that communities need to feel their input is listened to and taken into consideration. Procedures need to be in place to identify, document, and refer unmet needs to the appropriate actors. Referral could be done through consortia, coordination mechanisms, or NGO forums. Programs need to apply relevant technical standards, recalling what we've learned about the Humanitarian Standards Partnership in Module 1 of this training. Do your teams adhere to this type of processes in order to ensure the humanitarian responses are timely and effective? If not, there might be examples on these slides that become part of your CHS implementation or improvement plan. Take a moment to write them down. To fulfill the organizational responsibilities, we want to check that we have the relevant organizational policies and guidance. In the case of Commitment 2, the organizational responsibilities are 2.6. Program commitments are in line with organizational capacities, and 2.7. Policies commitments ensure a. Systematic, objective, and ongoing monitoring and evaluation of activities and their effects. B. Evidence from monitoring and evaluations is used to adapt and improve programs. And C. Timely decision-making with resources allocated accordingly. To which extent do your organization's documents cover this requirement? Policies or guidance that meet Commitment 2 include annual reports, strategic and country planning document, annual budgets for staff development, workforce planning, emergency roster, emergency preparedness plans, decision trees such as go, no-go analyses, capacity analyses, board or management agenda and minutes, monitoring and evaluation frameworks and M&E templates, program proposal and reporting templates, and budget. Does your organization have this in place? For the types of planning that goes into ensuring the organizational responsibilities are met for Commitment 2, many processes will take place at more senior levels of management. A head office will set criteria for decision-making around how much an organization can take on and will lead on staff and resource planning. Processes for decision-making, such as go-no-go analysis and capacity analysis, are based on templates and standard guidance that helps to standardize the information that managers use to make decisions. Teams that implement programs need to understand the criteria on which they are judged to be effective. Again, managers must lead by defining monitoring and evaluation policies, frameworks, and templates, as well as proposal and reporting templates. Project and monitoring staff have a role in ensuring adequate information for making decisions is available by using proposal and monitoring templates. As the CHS is really about putting communities and affected people at the center of our work, we also need to make sure design and monitoring processes are participatory and inclusive, and you will find these themes are also in indicators of Commitment 3, 4, and 7. Managers also establish budgeting templates, and finance staff have a role in ensuring budgets, including everything that is needed to implement a program, is available. In order to survey community perception of how the organization implements effectiveness and timeliness, communities can be asked the following question. First, does the assistance or services provided meet your priority needs? If the answer is negative, then unmet needs are asked about. Second, do you receive the support when you need it? And third, do you think that people who needed help were given enough support? If answers are negative, you will need to probe them and ask for more information. This is the end of the presentation on CHS Commitment 2. Communities and people affected by crises have access to the humanitarian assistance they need at the right time. You can take some time to reflect on this commitment. Go to another commitment in your own time, or listen again to this presentation.